is Dr. Haruna Isa. He lives in Kafanchan, a small provincial town 120 miles south of Kaduna. We followed Isa to his private hospital, 1 block down from his home on Main Street. The first of the patients is already waiting. I learned couching from my grandfather. He in turn was taught by his father. I was an apprentice for 10 years and first practiced surgery on animals. I use traditional medicines, which I prepare myself, but I also use Western drugs and treat couched eyes with cortisone eye drops. In depression, the inferior zonules are broken first, and the lens is then pushed down with the inferior equator leading. The first patient is prepared for surgery. He is sitting on the floor of the hospital. A topical anesthetic has been instilled, mixed by Isa himself according to his grandfather's prescription. A brief preoperative scrubbing maneuver appears to be more ritual and symbolic than effective, as does the subsequent drying of his hands with a cotton cloth. The use of a face mask also seems to be a loan from Western-style medicine. The couching needle is produced from a pocket of Isa's kaftan. The eye is stabilized with the coucher's thumb. The needle is introduced perpendicularly into the eye, entering 3 millimeters behind the limbus. It is gradually pushed forward with a rotating movement. The needle tip is moved downwards and disrupts the lower zonule. With some sweeping movements, the whole lens is then pushed down into the vitreous. This maneuver is therefore a cataract depression. The needle appears behind the empty black pupil. It is swept up and down several times to make sure that the cataract will not rise again. Some tears are wiped away from the patient's face. The patient opens his eyes and he can see. Dr. Isa demonstrates that he is now able to count fingers. Both he and the patient appear relieved. With a bundle of Nigerian naira, the coucher's son is dispatched to buy cortisone eye drops from the local pharmacist. We ask how the patient chose his surgeon. I went to Dr. Haruna because he has operated on members of my family with very good success. He is well known in the region. The needle is sterilized in a plastic pot with an immersion heater. It is carefully wiped clean with some cotton before the second patient is prepared, with its fountain pen-like top. After a couple of minutes, a more detailed functional examination is performed. The patient is able to count fingers, name objects, and describe the coucher's position from a distance of several yards. Both patients are happy and relieved.